Well, I start mentioning that I don't have experience with Ozempic face, but I have a lot of experience with patients to look for a solution when have a reduction in the middle part of the face. Let me doing that. Okay. Well, I start right now. Conflict for interest, difference between the profile of male and female. I use this avatar and put on them characteristics of male and female. And as you know, the malar is more projected in female and the zygoma is more wider on male. That's why usually we look for a triangle shape or trapezoidal shape when you look at harmonious face on the woman, and rectangular or square face when we look at a harmonious face on the male. I love the concept of this friend of mine, is Dr. Oscar Ramirez, plastic surgeon from Peru, but he live and work in USA, because he decided that the line of beauty, the double OG or double S arc, he published in many articles, and this is that. A combination of convexity, concavity, convexity, concavity. That means we need to have a great projection on the middle part of the face if we look for a beauty on this face, harmonious on the face. We mentioned about the beauty. In general, as a plastic surgeon, we look harmonious, we look symmetry. This is the way we can close to be a general concept of beauty in different culture. Well, we look for projection in the middle part of the face. And you, every one of you, daily look for that. Look, trying to give highlights on the malar area and bruiser in the cheek. You're doing that with your makeup because you look to have a projection on the middle part of the face and try to obtain a retraction on the lower part of the cheek. Because all of us look for that. Change, one face, a square face to triangle face. This is our objective. And there's many causes how a direction of the middle part of the face. Some are genetic, like Binder syndrome, aesthetic reason, great loss of weight, the age, and by when they intake antiretroviral medication. This famous, you know what is happening with the middle part of the face year per year, it fall down and reduce the size. And there's many ways to try to fix it. We can pull it up, or we can return this volume. I select return the volume by syntactic filler, by fat grafting, and by implant. But first of all, this is a little secret. Maybe it's a little pearl for you for today. When you and your patient have a logical doubt about what kind of procedure perform or what kind of quantity of filler you want to use on your patient, use that. The water test. That means you put water solution as the same volume that you think you can make the goal that your patient and you looking for this middle third part. As you can see here, in the left side, I put 7 cc of saline solution, but in the right side, nothing. And if you compare here in the vector system, you can see the line of beauty on the left and a completely flat profile in the right side. That's why it's a way you can be sure you can give you a classical projectile amount to a patient. How many fillers do you need to make this kind of change? Well, we have temporary, permanent, office operating room, prosthesis, lipofilling. We have many of them options, and all is a cost-benefit balance, of course. Non-surgical and surgical, I start with non-surgical. You need to mention that in my country, Argentina, polyacrylamide was allowed until 2019. I performed this kind of procedure until 2017. Many other ways to increase with implant. And now my results. I will start with fillers. This is a classical aesthetic reason and the way we create this line of beauty, with a great projection on the malar area, a male to look to have a feminine triangular face, and the way that I increase a lot this malaria with a total of 8 syringes. A patient with the consequence of HIV retroviral medication with a great lipoatrophy in the middle face, 12 cc to get improved not only in the malaria on the cheek too. Here is in the profile view the same. And now surgical procedures. We start with lipofilling. I use micrograph, particles for less than 1 to 2 millimeters. And here is my result in a patient who looking an improvement because have an aging process and lose all the cheek and the malar area. Here is in the profile. And again, the line of beauty you can see here. On this male with, again, retroviral medication, lipoatrophy, but we decided to use micrograph in total of 40 cc. This was made in surgery room, as you can see here. And again, the result using the Vectra system, you can compare both sides. And this is important over this patient because it's still my patient. And here is this result before. 1 year follow-up and 3 year follow-up. And what you can see here, the patient getting weight, not only in all the body, on the face too. That means that these fat cells survive and act as the rest of the fat cells of the body, increase the volume if a patient increase weight. In some combination of bichectomy and malar fat, because we create light and dark, that's why I reduce the size in the cheek and increase in the malar area. This patient is a model, and we create the line of beauty. And this is the proof of my work. Blue and light blue is the volume that increase, yellow the volume that decrease. And again, trying to simulate the way you use the makeup every day. When we talk about implants, there are many of them. I want to show you. You need to have some surgical skill for doing that because it's in a surgery room and you need to avoid the lesion of infraorbital nerve. In some cases, you need to customize the implant, cut it to be sure you don't want to push it or damage the infraorbital nerve. And here is my first example. It's a patient that decide first in the middle, the size number 1. After that, she don't agree with the result and looking for a new solution and looking for a better implant, and we obtain the line of beauty. And this is a male, he said that he's extremely ugly. He looked for a complete change. Well, I offered him a lot of implant, a lot of procedures, but important for you, looking at the middle part, I put this implant in the intraoral way, subperiosteal, and put the stitches in the subperiosteal to be sure it's not migrate and don't move it. And this is the great change. I obtained a patient look, especially in the middle part, because I obtained the line of beauty. These are the patient, again, I combined the malar silicone implant, bichectomy, endolaser, and rhino modulation. These lips not was made by me. I don't agree with this kind of lips. But here is, again, the line of beauty. And better than that, the patient is still my patient, 10 years of follow-up, and you can see here as implant don't move, don't reduce the size when the time goes by. When I was talk about another kind of implant, we now have the skills of uses drill and screw because you need to fix it. But we obtain this great change when the patient have a significant weight loss. And finally, polytetrafluoride implant. This implant is interesting because you can move it, you can reshape, and it's multiporous. That's why our tissue go inside of it, and it is complete attached with our tissues, finally, after a year. Before, this is one part with the prosthesis inside, the other part no, and this is my result, before and after, with a great change in the profile. Another patient with significant weight loss because extreme exercise, and here is the result using this kind of implant. Well, finally, on time, listen to my take-home message. Taking account the double OGI line, the line of beauty, I use it every day at my office. I put my patient in profile, in high profile, and I say you need to more or less projection. If there's any doubt about the volume, I offer you the water test. Please use it. It's free, it's cheap, and you can have at least the volume that you need with your patients. In my hands, if the water test is more than cc, I prefer the surgery because I don't want to use a lot of syringe at my office. When the volume decreases in over the malar anchic area, choose fat grafting. When you and your patient want significant or permanent result, choose an implant. If the price is a problem, choose silicone implant, it's cheaper. But if you have the possibility of, with the price and the skill of the surgeon, use of polyethylene implant or polyethylene or polyethylene implant. I invite all of you to this Congress, Sin Melasma. It's a Congress to be in this year between August 15 and 17 in the beautiful city of Bogota. Thanks so much for your attention.